Hello, I'm Marcia Testa Simonson, Vice Chair of the Wellesley Board of Health, as well as a town meeting member for Precinct C. During this presentation, I will cover reasons to support Article 3, Motion 2. As the Advisory Committee wrote in its report to this special town meeting, the COVID-19 pandemic has been and continues to be a major public health challenge of historic proportions. Since our health director, Mr. Lenny Izzo, issued his first townwide letter to the Wellesley community regarding coronavirus on February 28th, 8 months ago, the health department staff has worked tirelessly, often 7 days a week and as much as 18 hours a day, to keep Wellesley healthy and safe. The Board of Health, including Shepard Cohen, Linda Grape, and myself, want to thank them and all our town workers for their extraordinary efforts during one of the greatest public health crises of the century. During the early stages of the pandemic, public health services increased sharply to keep morbidity and mortality as low as possible. In response, the Wellesley Health Department added staff to provide critical public health nursing, health education, and social work services such as nursing health care home visits, COVID-19 case identification, contact tracing, issuing isolation and quarantine orders, and conducting disease surveillance and counseling. They also enforce hundreds of public health COVID-19 governor's orders associated with lockdowns, closings, and now phased reopenings. Their efforts, as well as local public health efforts throughout the state, proved to be very successful despite the many barriers they encountered. These public health successes have reduced transmission in the most vulnerable populations, including nursing homes, long-term care facilities, assisted living residencies, and congregate living and multi-generational households. Today, excess deaths from all causes, as calculated by the CDC in Massachusetts, are the only bias-free population health metric illustrating the end results of COVID-19 related health care and public health mitigation strategies on health outcomes. As shown in this graph of Massachusetts all-cause mortality from the CDC, public health efforts have resulted in no excess deaths since June 1st, 2020, and a mortality rate that has been below the threshold since July 1st. As the epidemic has reached a steady state labor going forward requires increasing the nursing supervisor position from 0.6 to 1 FTE, adding a full-time registered nurse position, adding 7 hours per week to an existing non-benefit 28 part-time hours to create a full-time benefited licensed social work position, and adding 10 non-benefited part-time hours per week on a per diem basis for environmental health specialist services. This organizational chart shows the areas where new hours will be added to health department staff and mental health outsource contracts in the areas of nursing, social services, and environmental health. The Board of Selectmen have agreed that expenses associated with these new hires and hours will be covered by CARES Act federal funds through December 30th, 2020, the end date of the CARES Act. This motion requests approval of the Health Department new hires and hours and funding in the amount of $61,600 to cover fiscal year January 1st through June 30th, 2020. The projected impact of these new hires and hours on the fiscal year 22 budget going forward will be a one-time increase of 16% over the fiscal year 21 budget. Thank you from the Wellesley Board of Health and Health Department staff.